Let's get an update now on the placement of junior doctors. You remember last week, over 280 had still not been given a post for their internship. At a time such as this, all trained medical personnel are required, surely. And yet it seems this funding issue has not been resolved. There are meant to be further engagements this week with the Department of Health. Well, let's get the very latest now from Dr Tshepile Tlali, Acting Chairperson of the Junior Doctors Association of South Africa. Good evening to you, Doctor. Could you update us on how many junior doctors are still waiting for replacement at this point?
Good evening, Sally, and good evening to all your viewers. So there's been quite a bit of radio silence from the ICSP with regards to what the new developments are with regards to the placement of junior doctors. So far, there are still over 280 doctors who are waiting placements. We haven't been able to get hold of them. There have been meetings the whole day. So, yes, it doesn't seem like our junior doctors are going to be placed in time for the 1st of July.
I mean, it's astonishing. And it's not just this year. This happens every year. I mean, you can go back and see the reports. There's always a problem. Is it all about money and funding?
Ultimately, it's all about funding. We have concluded amongst ourselves, and there have been some admission coming from the ICSP that there hasn't been adequate preparation in terms of funding the posts that are needed for junior doctors. We know that the number of junior doctors coming into the system for internship and community service are increasing every year, and yet there isn't an increase in the number of funded posts. The issue at the end of the day is funding, and we've been crying out and hoping that Treasury will increase the number of funded posts.
Just talk to me about what the ICSP is exactly and how it relates to the work of junior doctors.
So the ICSP stands for Internship and Community Service Placement Committee. There are a special group that has been organized by the Department of Health to place all statutory healthcare workers. That includes doctors, physiotherapists, occupational therapists, dietitians, dentists, you name it, all healthcare professionals that need to go through either an internship or a community service period. So they're interested, in placing those professionals. That's who we've been engaging.
I mean, I find it astonishing at a time like this when we need anyone who's got any form of training, let alone doctors, who would surely be invaluable during this pandemic, that this isn't at least fast-tracked for this year, even if there are systemic problems. What explanations are you given by the health department when you do get hold of them?
Indeed, I agree with you. This is the one time we really need as many people on the ground. The explanation is the same. Lack of funding. We've been dealing with this issue. Personally, I've been dealing with this issue for the past 2.5 years, and that's all it's been down to: lack of funding. We've had discussions about placing numerous foreign nationals who are trained in South Africa. They haven't been placed because of lack of funding. We've had issues with foreign trained South Africans struggling to be placed into the system, also lack of funding. So every single cycle, not just the major cycle, annual cycle, every single cycle, we have this issue where lack of funding is the issue.
And tell me, do doctors eventually get placed, or have you got a situation where you've got some junior doctors waiting years? So the Department of Health, or the ICSP, has informed us that they've got a tiering system in which they place the health workers. The first one is South Africans who were trained in South Africa. They have got first preference. The next one is South Africans who were trained outside of South Africa. They have the next preference. And then you have foreign nationals who were trained in South Africa, who are at the bottom, and then those who are not trained in South Africa and are not South African. So as far as I've been working with them, or I've been working with Judasa, engaging with them,
all South Africans eventually do get placed. Unfortunately, foreign nationals who trained in South Africa and who live in South Africa end up not being placed. There are people who've been applying for more than 5 years, waiting to start the internship programs.
So the 280 that are waiting, are those just from this year, or some of them actually have been waiting for years?
The 280 is those that are just from this year. So there's a bit of carryover from people who applied in the annual cycle but could not start by the 1st of January. And then those people who only applied this year because they only finished university this year.
I see. So I know that the junior doctors, my understanding is that you fall under SAMA, which of course regulates the doctors. So what sort of leverage do you have? Or do you just have to sit and wait, frustrating as it is?
Yeah, so we've tried basically everything over the years, you know. It took us a while to get to the bottom of the issue. We've been dillying and dallying. And yeah, up until now we know what the true issue is, and the issue is funding. And when you're told that there isn't funding, and you look at the context of South Africa and the economic state that we're in, you know, you kind of feel helpless knowing that when they say there's no money and you see what's happening in our country, you have to believe it, that there's no money. We just would like the available money that there is to be utilized in a better way to make sure that we have enough people working on the ground, especially now when we are within a deadly pandemic and within a third wave.
Do you feel that it's a little unfair that we've got Cuban doctors, or does that not really compare because they're highly experienced?
It does feel very unfair. In South Africa, we train very high quality doctors, and I'm not trying to disregard the Cuban doctors who have come to help us, but I think we train really high quality doctors who are aware of the burden of disease in South Africa, and you know, the money that has been used to fund the Cuban doctors could be used to fund our own doctors, which would go a long way to aid the South African health system, because you know they will be here for the foreseeable future.
All right. Well, thank you very much for that update, even though you haven't actually been given much news from the Health Department, any news at all, in fact. Over 280 intern doctors still waiting for a placement. That was Dr Tshepile Tlali, Acting Chairperson of the Junior Doctors Association of South Africa.